Welcome to True Wellness with Dr. D, the podcast where we explore what it takes to live with vitality, balance, and purpose. I am Dr. D, and each week I'll bring you powerful tools, inspiring stories, and expert insights to help you thrive in every area of your life. From health and wellness to mindset and navigating life's challenges, this podcast is your guide to creating a life of true well-being. Be sure to check the show notes and grab your free copy of the True Wellness Checklist so you can get started on your journey to true wellness right away. Now, let's get started. Hello, everyone. Welcome to another episode of True Wellness with Dr. D. I am very excited about today's episode because we are going to speak with someone who has been caring for me and my family for, almost over 20 years. I know we did a recording like this probably like 15 years ago.
Yeah, it still gets hits on YouTube.
Yes, absolutely. So today we are joined by Dr. Fazio, who has been my family dentist for years and years. He is a conventionally trained dentist who has been working for over 40 years, but about 33 years ago, through his own personal journey, he was like, wait a second, there's stuff going on in conventional dentistry that's just not working. And so he began the inquiry into biological holistic dentistry. And we are going to talk about what that means, because I will tell you day in and day out, one big thing that people often overlook when it comes to their health is their dental health.
Yes, ma'am.
And it is key to just about everything. Dental infection is one of those infections the body's not great at fighting on its own. And there's so much involved when it comes to the mouth. So Dr. Fazio, thank you so much for
Glad to be here, Danielle. Thank you so much.
Yes, Dr. Fazio is the owner and founder of Dr. Fazio's Holistic Dental Wellness, which is located in Smithtown, Long Island, where he practices his biological dentistry as well as holistic sports dentistry, which is a topic in and of itself as well. So, Dr. Fazio, why don't we start from the basics? Like, how is it that you went from conventional dentistry, which is, kind of the norm in our world, to the space of biological dentistry?
That's a great question, Danielle. And I think it's important for people to know how a dentist might change their viewpoint and eventually their practice philosophy. Because usually it doesn't happen easily for most people. But in my case, after graduating New York's University of College of Dentistry in 1988, I embarked on a conventional dental journey, working in a few places, mostly part-time, where I got my feet wet, so to speak. And over a period of time, I eventually started working full-time at a high-volume insurance practice, which happened to be in Queens, New York. And within about a 6-month period, my health started to change, slowly at first, but all in all, some changes that included sensitivity to light and sound. For example, I was wearing sunglasses indoors. Hearing loud noises would make me get startled very easily. I had no patience. Road rage, even. If someone came into my lane and didn't use their blinker, it would flip a switch on me, and I couldn't explain why. But eventually, there were periods of time where I felt an extreme amount of fatigue, days that I couldn't get up out of bed. In fact, was even fired from a couple of dental jobs because I couldn't show up to work. Well, at some point I realized something was going on, and again, it was happening pretty quickly. So I went to my local physician, who at the time was also a friend of mine, and I had every kind of test run known to mankind, looking to find out why my heart felt like it was beating out of my chest. Why did I feel depressed? Why did I have such a short fuse? Why did I not feel like myself? Well, make another long story short, all the testing came back inconclusively. Nothing was shown, nothing out of the ordinary. And it was kind of scary, frustrating as well. And my physician even told me at this point, Len, I think you just need to go talk to someone, as if there was a mental health issue going on. And I knew that was not really the case. There was no history, none of my family. And I knew that wasn't me, because these symptoms I was having, this syndrome, happened so quickly. And maybe it was coincidental that I was at that point working full time as a dentist, which I didn't do for the first 3 years of my dental career. So just quite serendipitously, as I was dealing with my own issues, as do some of the other brothers and sisters I have. One of my older sisters was in her journey to recover her health, specifically looking for ways to help with her underactive thyroid. Eventually came across the idea that amalgam fillings, which do contain mercury, might be the root cause.
Oh, yes.
And yes, but when my sister called me up that day, she said, "Hey, guess what? I found out this information." And I thought, what do you mean? Well, she said, "I'm going to go get my amalgam fillings taken out." And I asked her, "Why would you do that?"
Of
And
course.
her reply was, "Well, because I believe the mercury is affecting my thyroid in an indirect or direct way." And I said, "That's ridiculous." And
Hmm.
she was crestfallen because I think she wanted me to say just the opposite, like what a great idea and go for it. And I didn't. I truly believe that there was no risk or issue associated with amalgam fillings because that's what I had been taught.
That was
For
your training.
example, yeah. So in first year of dental school, every dental school, you, among other courses, will take a course called dental materials, and we discuss the different fillings and bridges and crowns and stuff like that. And on the day, I'll never forget because I'm old enough that back in the day we were, in a classroom and the instructor was writing on a chalkboard. And with his back to us, he wrote on the day we learned about amalgam fillings, he wrote what the ingredients were and listed them in order. Number one, mercury, 40 to 50%, followed by silver and tin and copper and zinc. And those of us who weren't really familiar were looking at each other in the classroom going, mercury, isn't that bad? Isn't that stuff that's in tuna? You should eat too much of
Right.
that? Yeah, mercury. I thought they were silver fillings. Aren't they silver fillings? Well, the instructor turns around as we're all talking and goes, "All right, everybody, listen. Yes, there's mercury in the amalgam fillings, but once you mix it with the silver, the tin, the copper, and the zinc, it gets locked in there, becomes inert, and therefore is a non issue. It doesn't cause a problem." Okay. End of conversation, never to be revisited again. Fast
Wow.
forward. All right. So when my sister called, I was convinced that, having gone to NYU, which is no third world country school, I thought we got a
No.
good education there and they should be right. And I truly believe that. In fact, probably about a month before my sister called me, 60 Minutes, the television news program, had done a segment which had a representative from the American Dental Association talking about this very issue about whether mercury that's inside the amalgam fillings are actually present a health risk. And
Mm.
during the course of the interview, the representative from the ADA said absolutely not, that there are no studies to prove any link between mercury exposure from amalgam fillings and the onset of any disease in humans. No studies would corroborate that, and that it's essentially a non issue. Well, then the interviewer said, "Okay, what about this? What about that leftover extra filling that doesn't make it inside the tooth?" And for the listeners, we should say that invariably a dentist is going to mix a little extra of the filling prior to installing it into the tooth because we don't want to run out and not have enough to fill the tooth because we have a certain amount of time to work with the material
Sure.
before it hardens. So invariably, there's some leftover of the very same material that made it into the tooth. There may be some leftover on the tray table that either the assistant or the dentist is next to. And the interviewer said, then why is it then that that extra filling material, that very same material that did not make it into the mouth or into that tooth, why is it that the Environmental Protection Agency requires or regards that uh, scrap, what we call scrap amalgam, as a toxic waste? And why is
Hmm.
it that they require that no one touch that very same material with their bare hands or not allow us to throw it in the garbage? And the interviewer, in quite frankly, was like a deer in the headlights. He didn't really have an answer for that. And eventually they wrapped up that segment. And within about 3 to 5 days, those of us who were members of the ADA, which I was at the time, received a letter saying that something to the effect that in light of this recent broadcast, you're likely to get some questions regarding the safety and efficacy of amalgam filling.
Mm.
Essentially, here are the top 5 questions, and here are your top 5 answers.
Hmm.
Well, it just perfectly supported the narrative that I had known and been taught. And so when my sister called me, I said, "Hey, it was just a program on 60 Minutes. There's nothing wrong with these fillings, I promise you." And
Right.
so I did not give her my blessing to go and have her amalgams removed by some crazy protocol from a dentist who I didn't even know. Well, P.S. She goes and has it done as she's a big girl. And when it was all said and done, something changed in her. And at first, I'll be honest, I thought it was like a placebo effect. And but then it lasted. And then I couldn't explain why her whole being had changed, her voice. The first time I spoke with her on the phone, I almost didn't recognize her.
Wow.
Here's somebody I've known my whole life. So I knew something wasn't the same anymore, but yet I couldn't I couldn't get it straight in my head. So why would that be? I mean, amalgams don't cause disease. So how could the replacement of her fillings then result in her having a boost in energy and overall change in her being? And so I went to speak to the dentist who did the work. I had lunch with him, and he instructed me that I had plenty of great questions, and I was asking all the right questions. But he said it was essentially complicated, and if I really wanted to know more, that I should go and see a dentist by the name of Hal Huggins out
Yes.
in Colorado Springs at the time. Again, we're talking at this point about early 1992.
Right.
So let's say just about 4 years, 3.5 years after graduating, I made a trip out to Colorado Springs in the fall of 1992. And as I was sitting in the audience, and Dr. Huggins, rest in peace, was explaining his methods and the type of symptoms and syndromes that are associated with chronic mercury exposure. I felt like he was describing me, and I finally, for the first time, got some information that essentially changed my life. Meaning that as he described the type of symptoms of which I had, and the reason why they didn't show up in blood work, and why my diet and maybe some genetics of mine might have prevented me from discovering this sooner, I knew I was in the right place. And at that point, I felt like, again, it was a dilemma. I mean, how could this be? I was asking myself, how could NYU have really gotten it that wrong? Has the American Dental Association really put out a false narrative on this? And I didn't want to believe it, but as I finished the seminar that weekend, I knew that I was on the right path. P.S. I had the very good fortune after I returned home to have lunch with Dr. Bresak, who treated my sister. And as we finished our lunch, he offered me a job, and I took it, knowing that this is my new path. And therefore, Danielle, it was very, very fortuitous for me because most dentists would not have it so easy. Again, as just an associate, someone who didn't own his practice, I had the flexibility of saying, yeah, I'm not going to work here anymore. Let me go that way. And after
Yes.
making that left-hand turn, I never looked back.
Yeah.
And I had someone who took me literally under his wing and showed me the ropes, brought me around, introduced me to all the right people, and got me my new education. And so for me, it was pretty quick. Again, I'm very fortunate that although I felt a certain way and I was pretty ill and no one had an answer for me, that I came across some information early in my career, stepped out of the conventional dental practice into an established biological practice, and it made it very easy for me to just say, okay, I'm embracing this new future. This new path is where I need to be. And like I said before, I never looked back. So over those last 33 years or so, I've learned a lot about not only how dentistry is, let's say, short-sighted and is complicated, but a lot about medicine, nutrition, and all the other things that go with, and
Mm-hmm.
understanding that everything we do on a daily basis has an impact on the body. We're
Yes.
just nowadays trying to maximize the positive or the upside and mitigate or eliminate the negative downside. And that has to do with a lot of things, including sometimes how we do things, but also the materials we select, and which I think we can go into detail about.
Yes. I'm a stickler and I send my clients over with
Yeah.
material.
Well, again, it's one thing to hear the information, but for a dentist to, to say, okay, that sounds great. I'm just gonna throw everything else I learned away, which we hold as gospel. What you learn in school, that's what you all know, and everybody's trained the same, so it must be true. And
Yeah.
it's hard. It takes some guts for someone who's going to just decide, well, they got it wrong, and I'm going to go this way. I tell
Yes.
you, it wasn't easy. It was no one is giving you support. I lost some
No.
friends who didn't believe in what I was doing, and I realized, well,
You're a quack, right?
yeah, well,
That's
I
it.
was the
What to
quacky guy.
do.
You know what, Danielle? After a while, I embraced that. I embraced being the
Yeah.
outlier. I embraced being the outlaw or whatever, the quacky guy.
Yes. Yes.
When you believe something and you truly believe it, people will get that from you.
Yeah.
And I just kind of did my best to stay under the radar, don't make any waves, and just do the right thing and treat one patient at a time.
Yes.
But here we are 30 odd years later, and now we're finding that we've been
Wow.
right all along. And I think finally the society or the culture, or the time in history is now ready to hear this information. So
Yes.
let's give them what they need to know.
And they're listening. And I mean,
Yeah.
first of all, thank you, right? Because if
Yeah.
you didn't go on your journey, I wouldn't have a dentist who is savvy like you are.
Again, Danielle, I'm fortunate how things turned around. Let's give credit to my sister, or the colon therapist who was treating my sister, that put the nickel in her ear and said, "Hey, I think you should get these out." Uh,
Yes.
and that led her to the other dentist. And again, I don't question. But ever since then, I've kept my radar open or my ears open to everything. And the universe has a plan, and I'm just lucky to be someone who has decent skills, who's able to again save himself, become healthier, recover my own health, and keep my own dental skills sharp, so that
Yeah.
this many years later we can still do the right thing by people.
Absolutely. And I know whoever's listening is part of the universe's plan for them to hear this
Agreed.
information today, because
Yes.
it's so important. I
Yeah.
mean, you remember I had the one mercury filling in my mouth that I got when I must have been about, I was in college. So I must have been 19, 20 years old. And, as I began my health journey, realizing in the whole like conventional world versus, hey, diet, nutrition, lifestyle, all
Yeah.
these things matters, not just taking medication after medication to cover
Right.
up symptoms.
Yeah.
But I had started to get really crazy rash on my arm, and here I was already a holistic practitioner, and practice you don't practice on yourself, and you're
Yeah.
kind of at the bottom of the list, and I'm like, what, you just kind of, oh, it's a rash, maybe I ate something or something, and
Mhm.
then it wouldn't go away, and it was persistent. The more and more I used the QRA testing, I realized, like, oh my gosh, it's that tooth in my mouth, and you remove that tooth, because we have to talk about removal, because the
Yeah.
removal process
That's so important. This
is
is really
critical.
a key. Yes, ma'am. I agree. That's
I
key.
don't want people to hear this and be going out to a regular dentist saying, oh, just remove it. Because I know
Yeah.
you and your practice, like, it is set up with specific protocol to make sure that removal is actually safe. Think about it. You said the EPA says you can't touch that, you can't throw it out. So what happens as people are removing it from their mouth, if they're not paying attention, we now have another problem to contend with.
Yes.
So tell us a little bit about the removal process, and why wouldn't you just like go to your regular dentist and ask him to remove it?
Well, that's a great question, and again, this is super important. So let's go into some details. Essentially, it's bad. Let me say this: it's bad enough when the filling has already been installed in the tooth, because, as we know,
Yes.
there are exposures that occur. Most frequently, I should say, exposures from the fillings, and as far as mercury vapors coming out and
Sure.
related particulates around the time people are eating, when they're brushing their teeth, or anything causing any kind of physical contact with the fillings. It stimulates the release of mercury for a period of about 90 minutes once the stimulus has ceased. Now imagine when you go in a dental office and he takes a high speed handpiece, which has a drill bit that rotates about 400,000 RPM.
Oh my
Okay,
God.
something pretty fast. And
Yep.
once it makes contact with the filling, then there's an immediate vaporization of that filling in the tooth structure, whatever it's making contact with. Well, the young lady that's usually sitting on the other side of the dentist is over there, doing her best to capture the particulates or the aerosols. But the typical situation is way insufficient, I should say, as far as being able to capture that stuff. So invariably, the dental staff, the dentist, the assistant, and most importantly, the patient are getting some exposure to the materials making up that filling. And of course, we know that in the case of amalgam, we have mercury in there. So as the dentist is drilling out a mercury filling, they may instruct the patient try not to swallow or whatever, but invariably that patient is going to either swallow or more likely inhale vapors that are created at that time. And that, let's say, exposure is acute. And if it is inhaled, it goes immediately to the bloodstream, and therefore the route of administration or the route of exposure is very direct. And therefore, from there, depending on the patient's body mass, depending on their genetics, will determine whether that mercury gets stored away or whether it's beginning to pile on to an already existing condition. So, in a biological or holistic dental practice, then there are a number of safeguards or systems to be used, many of them redundant, in order to make sure that at every possible turn, once we know that we're, unfortunately having to create or make contact with an amalgam filling and create the vapors that are a side effect, then we have to be in a position to capture them immediately. Ideally, right at the sources where they're happening, so at the site of the tooth, but also install some safeguards for the patient to make sure that, because they know we know that they have to breathe and swallow during that visit, to make sure that they can't breathe it in or swallow any particulates in order to mitigate and prevent any additional exposure during the removal process. Um, if anyone was looking specifically to know what does that all mean? Is there a specific protocol out there? Is there a universal protocol? that biological dentists should follow? And thankfully today, the answer is yes. The acronym for that type of safe removal protocol is SMART, SMART, standing for Safe Amalgam Removal Technique. And in that technique, all of the safeguards are required by the practitioners who are certified to make sure that at every filling, no matter how big, how small, or how many are being utilized or affected in that visit, are being protected, or I should say that the patient is being protected each time the filling is being removed. So that the ultimate goal is to remove the fillings with a minimum amount of drilling, always endeavoring to remove the filling in one big piece to leave it as mostly intact as possible, so that most of the mercury stays in the filling. Therefore, we're not having to capture more. So the more drilling is done, more vapors and particulates are created, and it makes it a little bit more challenging to capture it. So if we can keep the filling cool, and that would mean that, among other things, the assistant is spraying additional water onto the surface of the filling as the dentist is drilling to suppress the formation of vapors, then that makes the suctioning or capturing of the particulates and vapors much more efficient. Additionally, and that's what's going on at the side of the patient. Additionally, we install something called the rubber dam, which is a physical barrier or gasket that's placed around each tooth prior to the filling being removed, so that none of the parts and pieces, and as well as none of the vapors, can actually be brought into the mouth. So there's some very simple but yet very effective ways of mitigating the formation of mercury vapor, but capturing the stuff we know we're going to create during that visit. So if someone were to go to, and we can list, Danielle, the organizations that provide certifications for biological dentists, so that if someone's looking to find someone in their home state or nearby, or for a family member somewhere,
Yes.
you can go to these organizations, which we'll list, and go to their directory, and
Yeah.
your patient will be able to find someone near them, type in usually their zip code, and find out who's nearby that has certain certifications. Certainly, the SMART certification is absolutely critical.
Right. And you even have air filtration and such. And then you,
Yeah. So again, because of my particular experience, and again, I want to give props to Dr. Huggins. It was he who first put this all together, that says that there should be some sort of universal protocol for protections. But he took it a step further in his location out there in Colorado Springs way back when, by creating essentially a Faraday box or Faraday cage of an operatory where he did the treatment, meaning that any particulates and external effects like electromagnetic fields were not going to interfere with the removal process. As we all know, us humans are very sensitive to electromagnetic fields. But in Dr. Huggins' case, he was able to capture the airborne particulates that don't get caught up into the suction that the assistant has, and trap that or capture that electrostatically by installing negative ion generators in the operatory. I do that. Most dentists who get the SMART certification will install ionizing equipment. But I took it a step further, knowing that I felt that would be good. But what if it's not adequate? And I thought, machines can fail. And what if the ionizer is dirty and it's not producing enough ions? What if the collection plate is clouded or dirty? Then maybe the efficiency is brought down. So I thought, well, maybe if we actively move the air out of the room, in addition to all that stuff, would be a great idea. And so in my previous office, as you might recall, I had exhaust fans mounted to all the exterior walls on all the treatment rooms, so that as we worked, we actually pushed air right out of the room, sort of flushing the air out of the room during and after every visit. And in my new office in Smithtown, we have the same thing, what we call a negative pressure system installed, so that as we slide the door, we have a flow of air, a laminar flow of air from the back of the room toward the feet of the patient, so that as we're drilling and creating these vapors, they are literally moved away from our workspace, which increases the safety for me, my assistant, and the patient.
yes.
It also continually scrubs the room even after the drilling is done. All right. So one major shortcoming for a lot of dental offices is that even if they have the precautions that are used, let's say at the side of the mouth and for patient protection, a lot of times the room itself, or even the way the office is set up, will do nothing but recirculate the aerosols that don't get captured. And that could be a problem. Even let's take something like viruses and fungus that gets blasted out of somebody's mouth during the cleaning or whatever. In our office, we're not taking those chances. So, especially in the rooms that we do drilling and create aerosols, we have the negative pressure system installed so that even after the drilling is done, we're still cleaning the air out, because we know that what what goes up must come down, and the things that we can't see don't mean that they can't hurt us, but we assume that they're there. And so for patient protection, for staff protection, we have negative pressure going on at all times.
Yeah, that's awesome. And you know what? I'm really excited too that you pointed out EMFs, because I remember we did some remediation work on
Yes.
your office as well. So
Yeah.
like you have a practitioner and a provider who's paying attention to all these things that no one else is paying attention for. That was fun because we did your office, and then I know we also went out and did some work out there
Yep.
in Port Jeff too.
Yep. Well, if you're ever back in New York, I can have you come back over and cook in the new place. I think I need a little bit
absolutely.
more than just some sage. In
Yeah.
the,
Well, this is beyond sage. Yeah, for
yeah, yeah.
sure. Absolutely. But I think that's really important, is because I mean you've taken even just biological dentistry to a whole other level, looking at all of these different pieces. Like, how is this really going to benefit my patients? How is this going to take care of my staff? How
Yeah.
is this going to have an impact much broader than just the kind of the day-to-day stuff? And I
Again, I want to say that it was because something happened to me, and I knew I
right,
never wanted to go back there. Okay, where most dentists, that's not their motivation. But most of the good ones out there that are practicing biological also have a similar story where they had some health challenges that no one can help them out with, and it got to the point where they heard this other stuff, and then you become now the wounded warrior who decides, nothing is going to dissuade me from practicing this way, and you want to. Those of us who are really in it for the right reasons will want to, help their patients and help themselves. We have to be there in order to help more patients. I got to make sure I'm staying healthy and that my staff's not calling in sick and all these other reasons. So my motivations are truly altruistic, that
yes,
I think it gives people peace of mind when they come in there. So
right,
we do market that, hey, this is a safe place. There's nothing like it. I believe there's no other office on the East Coast that is set up quite the
yes,
same. But that should be something which would probably give most people the inkling as to what level are we committed to
yeah,
this philosophy. We're not
right,
just casual observers going, sounds like a good idea. No, no, no. I would say well, on that vein, I would say maybe if someone was trying to investigate, if they come across the name of someone who's practicing biological dentistry, they should visit that doctor's website, and it should be pretty obvious that in one of the drop-down menus, like our services, or maybe even a tab devoted
right,
specifically to biological dentistry, that there should be quite a bit of information there showing the level to which this person is committed.
right.
How does this affect their practice? Are they just someone who doesn't use amalgam fillings anymore and are calling themselves holistic? Well, there's plenty of
Yes,
those out there, but you want someone who can, once you get a True Smart certification, well, you're putting some sort of icon or badge on your website to show that, hey, we're truly, worth our salt here. And so patients can kind of vet the dentist prior to going in there.
yeah,
Of course, my best advice to anybody is, trust your gut. And I'm saying that just because people know if someone's good or not. But if the patient gets the information first and is not relying on the dentist to convince them that this is what they need, that's always the best scenario, where the patient then is going in armed with information and is definitely in a position to kind of interview the dentist.
yes,
You know what I mean? Where they can go in there and ask the right questions. And on my website, I have some pages dedicated to that, meaning that we should have create something that patients can look at and therefore know what kind of standard should this dentist be held to, what kind of questions should I ask, what should
right,
I demand or expect, and then obviously receive that.
yeah.
So it's all about getting the education first. Thankfully, people can Google search this very broad terms and get a lot of information, which is out there now.
Yeah, it's important because I know I'll tell you, I've got a lot of clients, and I'm like, hey, I mean, especially if they're Long Island, I'm always sending
Yeah.
them your direction personally. But they're like, well, I've had my dentist for the last 20 years, and I love my dentist. And I'm like, well, how is your dentist practicing? Or when they mark off on their paperwork that they had their amalgam removed, my next question is like, well, how was that removed? What were, do you remember any specific
Yeah.
precautions your dentist took? So
It's
it's
tough.
always,
It's tough because it like a hairstylist. You get comfortable with your dentist.
yes,
You want to stick with that person because they know you and you're comfortable. There's a certain level of comfort there, and I get that. And even with the best of intentions, a dentist might say, "Yeah, I'll remove your amalgam fillings." But Danielle, I've seen it time and time again where the patient comes after the fact and they ask me,
yes,
"What can I do now?" When it's not being done correctly, and the patient gets, like I said before, an acute exposure, which in some cases kind of push them over the edge or be the
Yes.
straw that broke the camel's back.
Yes.
At that point, it's already too late, and this is why it's really important for the dentist to say, listen, nothing personal, but for this particular thing, it's important to me that I go to someone who has a special training that's
Yes.
going to deliver this. And I see it all the time. Patients are not obligated to stay in my practice. If they have that dilemma and they really like their dentist, or maybe their insurance is accepted at their dentist's office and they're not
Sure.
willing to break free from that, I say, fine, we can just do this as a specialty treatment. Just
Right.
like you might go to an oral surgeon and have some teeth extracted. Well, you can go to a special dentist, a biological dentist who is smart trained
Mm-hmm.
to have the amalgam fillings removed, and then go back to your dentist and have him or her uh, continue on with your continuing care. Of course,
Right.
everybody's is welcome to stay at my office, but we don't, tell people that they can't go anywhere else. So
Yeah.
it really depends on the patient's level of commitment, if you will, to know that this is important to me, and that's the most important thing is for the patient to feel that this is logical.
Yes.
Think I don't want this toxic stuff in my mouth.
Right.
And if it's their decision, again, we're not in the business of trying to convince people this is what they should do. But if someone has already, like I said before, already made up their mind and they want to have that done, then it becomes imperative that they find someone who is truly well practiced in doing that. And nowadays, let's be honest, you can check the Yelp and Google reviews, I'm sorry, to determine, have other patients, had a positive experience there.
Right.
Like it or not, I mean, that is really a nice barometer to determine the level of care that's being delivered at those places.
Sure. The other thing that I want to talk about that I think is really pervasive in conventional dentistry that isn't talked about is fluoride.
Yeah.
Tell me
Huge.
about fluoride.
Yes, please. This is important. So
Yes.
in our office, obviously we have someone sign a release among the other paperwork that they come in, but on their new patient intake forms, one of them is a statement that says that I personally do not use fluoride in the management of caries or cavity prevention. And it
Mhm.
further states that the patient understands this and that they're okay with that in so many words, and that our methods of fighting tooth decay are going to be involving, let's say, nutritional counseling or maybe looking into genetics to a certain degree. And looking at airways and all the other things that might be contributors to cavities. So if we understand or go on that principle that cavities do not form simply due to a lack of fluoride, which is sort of how kind of most people feel. And unfortunately, most of the pediatric dentists feel the same way, that by taking fluoride, this will be your best bet to fight against tooth decay.
That's what we've been told in
Yeah,
training.
well, we've kind of been told and brainwashed, and most people believe that. All the advertisements and toothpaste ads and
Sure.
everything else will kind of back that up. It's big business, and it is, unfortunately, to me, it's like a crutch that people
Mhm.
lean on, figure, well, I can eat the way that I want, or I can do what I want, and or not do what I'm supposed to, and just use some fluoride toothpaste or give my kid fluoride treatments, and everything's gonna be okay, right? Well, as you ask any dentist who uses fluoride, they'll say that, yeah, I have a number of patients who still take the fluoride and they still get cavities. So what's up with that? So,
Right.
so here's the rub, and basically the takeaway with fluoride is in large doses, fluoride is toxic. And
Yes.
the problem with fluoride exposures that it's too easy to get too much.
Yeah.
Meaning, let me tell this story, and most parents will have been through this. At around age 6 months, you go back to the pediatrician with your new baby, and they'll tell you, okay, now it's time for the polyfluor vitamins.
Oh,
Okay?
yeah.
Usually at 6 months.
Hmm.
And now the thinking, well, let's now intentionally give this child fluoride orally to let it magically work its way through the bloodstream and settle in the teeth and make them super strong and make them resistant to tooth decay, right?
Right.
Well, the logic is obviously flawed, because if you take something in the mouth and it makes it to the bloodstream, it can go anywhere, including your brain, including your thyroid, including your other tissue symptoms or glands and organs.
Yes.
So the shotgun approach would literally blast in the body with fluoride in the hopes that some of it will make it to the teeth during development is also flawed. So if this is something that's done regularly, again, now we're looking at number of exposures, so dose over time,
Hmm.
other medication being given. We can look at fluoridated water as another risk factor. So municipal water supplies that are using fluoride in them are
Hmm.
now increasing the amount of fluoride. So not only is the child in those areas getting fluoride at the dentist, and if he's a good little boy or girl, also using fluoridated toothpaste. And now they might be bathing in fluoridated water, and they might be cooking with fluoridated water or drinking it. Now we're looking at exposures that way exceed what was originally thought to be an optimal amount. Okay.
Mhm.
And if you look on any tube of toothpaste that contains fluoride, it'll say very plainly, we're talking every tube, that it says, if swallowed, call the poison control center immediately. And why is that? Because fluoride
Right.
is a poison. So
Right.
the thinking is, it's okay to use a little poison every day and brush your teeth with it, and maybe get some poison at the dentist, periodically for your fluoride treatments every 6 months, but don't swallow it. And if you do, call the poison and control center immediately to get your stomach pumped,
Right.
because we know. All right. So unfortunately, the other commercial use for fluoride is as a pesticide.
Mhm.
Um, Fluoride gas was used during World War II to control prison populations, because why? Fluoride exposure lowers IQ. And
Yeah.
there's a landmark case happening now on the West Coast where fluoride, municipal water fluoridation is being challenged, because multiple studies have confirmed that the population, or IQ in the population of children, has declined. Among other things, the thinking is that the chronic fluoride exposure is leading to that lower IQ. So
Mhm.
if we think that fluoride is a poison, we know that fluoride's a poison. Okay, everybody knows it. In small amounts, somehow magically, the different forms of fluoride, apparently in dentistry, it's not a poison, and that the efficacy or upside is much greater than the risk. In our office, we believe otherwise, and therefore we
Yes.
decide that if we're going to truly be natural and help our patients thrive and be healthy, then we should limit their exposure to toxic materials that routinely occur in the dental office, and fluoride is one of those easy ones to pick on. So rather than suggesting fluoride treatments, we're going to talk to mom or dad about that child's nutrition. If a kid comes in as a young one and has got a mouthful of cavities, we're thinking, well, why is that happening?
Right.
Maybe that child's a mouth breather. Maybe that child has a restricted tongue, leading to a poor airway development.
Mhm.
One reason for cavities to form. Maybe mom was not counseled during pregnancy to have good nutritional support.
Right.
Maybe other than her prenatal multi and some folic acid, what kind of nutritional support or counseling does a pregnant mother get from their OBGYN?
None. Right.
But even though there might be some genetic predisposition for disease that everyone is born with, it seems that when a baby is, forming in utero, that if that child's not getting enough proper nutrition via the mom, then that child's already born at a disadvantage. So
That's
then it might be that mom didn't get enough minerals, something as simple as just minerals in the diet that she
Mhm.
can't pass on to the baby. And so that as the bones and the teeth are forming, they're not maybe as dense as they could be. Vitamin D levels, I mean, any number of things that are absolutely critical to the formation of strong teeth and bones is rarely talked about in the dental office. In our
Right.
office, again, having been a biological dentist for so long, I learned a thing or two about medicine and nutrition. And this is why we say, yeah, cavities is basically a disruption in, let's say, biological chemical levels or biochemistry, and maybe some genetics, and maybe some poor diet, and maybe all of those things. So we do our best to kind of suss out which ones are appropriate. Again, most of our new patients, the parents are very good about what their child is eating and what they're exposing their kids to. But yet
Sure.
even those very same kids are still getting cavities. So uh, our focus, is to manage them as, let's say, conservatively as possible, and not subject, certainly like in the pediatric environment, to say, well, you need more fluoride, which is usually the first response. We're going
Right.
to say, all right, well, pump the brakes. Let's have a conversation. What do we do about this? What is your child's diet like? What can
Yeah.
we do to add to the diet? Maybe not tell them to go get everything gluten free, and because kids are very sort of resistant to that. We start off kind of baby steps. Just try this, add that, or eliminate this, with the hopes that we're going to say, let's really concentrate on the adult dentition. And if the baby teeth are already showing signs, we take that as a red flag and say, all right, we got to do something about it, and let's do what we can do for your child, so that, like I said, the adult teeth, as they grow in, they're healthy and happy. Creating the room for them, again, which also is involved with the airway space and the tongue management, will help that a lot.
Yeah. Well, I mean, it's the same thing, it's even when it comes to conventional medicine, it's like, let's just put a Band-Aid on it,
Well,
versus
most
let's
people are
figure
not
out.
involved. Yeah, we don't have the time really to suss out why does that kid have cavities when the next patient comes in is developing or expressing cavities for a completely different reason. So it's
Exactly.
easier for the dentist to just say, okay, well, we got this one way. Just give more fluoride. You need more fluoride, And if that kid comes back 6 months later, still got cavities, your kid needs more fluoride. Maybe try a different type.
Mm-hmm.
Maybe we don't. But the fact is, as I said earlier, it's too easy to get too much, and that's the problem. And by taking it in the mouth and swallowing in fluoride, whether you're living in a fluoridated area or taking the tablets that have it in there, that's really the worst thing, is that you're really exposing the entire body to fluoride, for which there is no known requirement. Okay, no one has ever been told they're fluoride deficient. It's not an essential mineral or nutrient.
Exactly. Like we're not aspirin deficient. That's not what
Correct. Exactly.
right?
Mhm.
Yeah. But it's true, Dr. Fazio, I'm always telling my people, right? We've really got to, see, think, and do things differently. And so we've got
You
to
have to be your own best advocate.
why is that happening? Not just, oh, what's the fix? No, no, no. Why is it happening? And honestly, social media has its pros and its cons, and everyone's like, now really it's like, oh, I saw this on whatever, it's going to fix,
Yeah.
whatever symptom and issue. It's like, but you still got to understand why.
Yeah.
So
Agreed.
the next fluoride toothpaste isn't going to fix the cavities.
No.
Now, you said something that's really, really important, and I think is really overlooked in terms of health. And we've had Dr. Lane Martin on
Yes.
before,
Yes.
who has
It's all about the airway. Yeah.
yeah, Dr. Martin too. So talk to me about airway. When you're talking about airway, what do you mean, and what are you seeing happening with patients in your practice?
Well, when I think of airway, the general first thought that comes into mind is insufficiency, or too small of an airway. And this is, in many cases, a developmental disorder. Let's call it that. Something that we might be able to pick out, when it happened, but maybe don't have the answers to why exactly it's happening in everyone. But one easy thing to understand would be that the tongue itself has a lot to do with the development of the oral cavity. Okay,
Yes.
so we screen every person, every child, every woman, every man that comes in the office for a restriction of their tongue. Now, in severe cases, most of those are picked up in childhood, but only if the child was having maybe some difficulty with speech, or the speech
Right.
pathologist thought this child has a tongue restriction, or is lisping, or is choking on their food, or otherwise unable to form certain sounds.
Yes.
Those obvious cases are usually addressed. Many times they're not addressed fully. Someone might be told, go get your tongue released, which would involve severing the ligament under the tongue, or
Mm-hmm.
even the upper lip, which could be restrictive and not allow the tongue to reach its full range of motion. But
Right.
in many cases, that's insufficient. It's not enough. Strengthening the tongue, ultimately, a free, fully mobile tongue actually is what forms the upper jaw. We call the maxilla. For example, every person, when they're not speaking or eating, their tongue should be resting on the roof of their mouth. And that tongue should then be kind of placing a mild to moderate pressure on the palate. And as it does, especially during development as a small child, that is actually forcing the palate forward and widthwise,
Yeah.
creating a nice, beautiful arch shape, of which is a mirror image of the tongue, essentially forming that jaw. And as that upper jawbone is developing and gaining its dimensions, so too are the sinuses. And so too then, with a truly free lower jaw, the lower jaw or mandible will advance. In those cases, children are fortunate enough to be breastfed and latch on right away and don't have a tongue restriction, they tend to be the most vital people that we know, because they're starting off on the right foot. No pun intended there. But the fact is that they're able to eat and drink, to nurse without difficulty, and then kind of training their tongue to have this repeatable formation or action that continually supports the continued growth of the jaw bones through puberty. So in children who don't have that, in children who are only nursed for maybe a couple of weeks or maybe a couple of months, they may not get that full benefit of the tongue, and develop that tongue, to strengthen that tongue to continue to form that upper jawbone, which then again creates the room to breathe. Those children who do have it, they tend to be less colicky. They tend to sleep really well throughout the night. They tend to have beautiful looking teeth when they're adults. So we screen everybody, and I know, because I have it, that most people have a degree of tongue restriction that doesn't trip any wires or ring any alarm bells, because they're not slurring their words, or they're not choking on their foods.
Yes.
So and inadequate breathing space, which essentially is in the mouth. We see in adults as sleep apnea. Some people, in severe cases, are having actually requiring machines to pump air into the mouth to overcome, which I believe is the common denominator, which is the restricted tongue. So children who have this, who don't breathe or are forced to breathe through their mouth because they can't sleep with their mouth closed, or their upper maxilla or mid face in this area is underdeveloped, their sinuses aren't big enough, and therefore they have difficulty breathing, are then forced to breathe through their mouth. And what comes next? Dry mouth and cavities. So
Right.
saliva production is reduced. I mean, there's a whole cascade of events that occur just from a simple thing like a tongue restriction. So, by
Hmm.
rights, on day one, when that child's born, assuming this child's born in a hospital, the neonatologist should be looking at, among other things, the looseness or ability of the tongue to be freely moving around.
Right.
Invariably, what they see as normal is probably, in many cases, not. Unless the tongue is severely tied down, they won't have that tongue released in the hospital or shortly after the baby's birth. And that, again, will set the stage for that child not to really be fully viable. Not that they can't be, but they're going to have a tougher time. Mom and dad are going to be more frustrated. That child's going to not sleep well. That child's going to be colicky and cranky, and you know what comes after that. Everybody's frustrated.
Everyone's upset.
Yeah. So again, we can't necessarily do about it anything about that. I'm sorry, in utero. But once the baby's born, this should be something most parents are on the lookout for. By
Sure.
right, by rights, the pediatrician should be screening all their kids because they're on the front line
They
doing
are.
those checkups. They should say, okay, maybe not a newborn. What about 3 months later? How's that
Right.
kid's tongue doing? Ask mom. How are you still nursing? Are you able to? And if mom's having difficulty, early on, we know maybe the La Leche League might step in and say, hey, no, you got to keep trying here. Don't give up so quickly.
Right.
A lot of moms are just completely frustrated. They're sore. It hurts because the child's not able to suckle correctly. And that complex uh, between the lips and the tongue, that let's call it concert of action, is restricted if the tongue is tied down too tightly. So it's fixable. We recognize it. Again, we can see our kids as they're developing whether their lower jaw is insufficient,
Hmm.
usually by age 5 or 6. And typically, most dentists are going to say, "Oh, your kid's going to need braces." Shuffle them off to the orthodontist, as I did with my own kids. I wish I
Right.
knew this back then, but
Right.
that's really not addressing the cause of the problem. Okay, it's just orthodontics is another band-aid on the problem.
Sure.
Whereas biological dentists, we're always interested in finding out why did this happen, what can we do about it, how do we fix it.
Yeah, it's so true. But I mean, it's not only just impacting the kids; it's impacting such a large percentage of
Oh,
the
huge! I would say
adult
it's
population.
epidemic proportions. I
Yeah.
mean, you see everybody talking about CPAP machines, and
Yes.
everybody knows somebody who snores.
Yes.
Okay, so
Yes.
sometimes the symptoms are subtle.
Mhm.
Sometimes they're, we could say that persons who might have a little extra body mass on board might be more prone to it if there's extra tissue, let's say. But even persons who aren't dealing with that can still have it. So it really doesn't, it's not a weight issue. It's not a dietary issue. It's a matter of, was the oral cavity developed to its fullest potential? Did that person require their wisdom teeth to be removed because there wasn't enough room in the jaw?
Right.
Usually it's because the tongue didn't help grow the jaws right from birth.
Right.
Yeah.
What are your recommendations in your practice when you see these airway issues show up?
Well, again, if we're looking at a child, then we're going to say, all right, listen, mom or dad, we see that there is a restriction here, which we screen our kids right in the office. And
Hmm.
if so, I'm going to recommend two things. First and foremost would be to have what we call a myofunctional evaluation by a
Hmm.
myofunctional therapist or a myotherapist to evaluate very in depth just how well does the tongue and the lips work in harmony to allow that child to chew and swallow their foods.
Yes.
Within 10 minutes, we can find out a whole host of information.
Sure.
And if that's the case, the myofunctional therapist might determine that exercises alone may not cure the issue. And
Hmm.
some kids are fortunate that if there is enough room and the tongue is not too restricted, or the ligament under the tongue, we call the lingual frenum, is not too short, that just some good old fashioned exercising of the tongue and the lips can retrain the tongue where to be, and therefore support that proper positioning, which we call tongue posture, that will help with the continued development of the jaws and create that nice wide open airspace. For kids who have a truly restricted tongue, that may also require a visit to one of the local oral surgeons, or in our case, we're very fortunate in the Long Island, New York area to have Dr. Scott Siegel, who has completely revised his entire oral surgery practice to someone who's all about airway management and tongue.
Wow.
Yeah. Again, he sees people, and again, we all agree that it's of epidemic proportions that how many people are affected this way. But to have someone who's going to first make the the evaluation to decide, number one, is there a tongue restriction leading to the poor airway development? And if so, address that.
Yes.
Now, in kids, that's easy to do because we can take advantage of the fact that their bones are still growing and that their bones are still plastic, meaning
Right.
that they're subject or able to be formed and shaped. In a full-grown adult person, we don't have that option. And let me
No.
give you a prime example, and you're looking at them. Here I am, 62 years old, going to be 63, and I have had since birth a restricted tongue. I was never breastfed. I was bottle fed right from day one. Thank you, Dr. Spock. And therefore, I didn't have the type of airway that should have been. As a result, when I look back now, I can see I was a very sickly child. I had a lot of difficulty breathing. My ears, nose, and throat. I was constantly at the ears, nose, and throat doctor. Ultimately, by age 7, I was so bad, and I sounded like this because I couldn't breathe. I
Right.
had my tonsils and adenoids removed because there
Yeah.
was nothing else to do. Right? Again, treating the symptom, not
Yes.
really realizing that my airway was restricted. As a result, I had very crowded teeth and was prone to getting sick a lot and tons of cavities. Classic presentation.
Yes.
So here I am this many years later. And as I recently built the office in Port Jeff, I was maybe under a little bit of stress as I was doing that. But it became apparent to me that I was also not breathing very well and not sleeping very well. Well, at first I'm thinking, well, yeah, it's a stressful time right in the middle of the pandemic to be relocating and having to build a new office. But
Mhm.
I knew it was more than that, Danielle. And because I talk to people every day about this, I'm thinking, wait a minute, you have the same symptoms that you're talking to your patients about. What do we do about that? So
Right.
I got a sleep study. It confirmed what I already knew, which is that I have a degree of sleep apnea, and that I wake up a few times during the night. And the doctor who screened me said I need an appliance, kind of like what Dr. Lane Martin is prescribing, something
Yes.
that's sort of a quick fix, but it does allow you to breathe more easily and it does allow you to oxygenate. So it serves its purpose, but it is also not curing the problem.
Right.
Okay. For me, as an adult, to cure the problem, I can't just go to an orthodontist and unfortunately get palatal expansion. Okay,
Yeah.
my bones are fully formed and they're fixed, and there's no way to just kind of expand the bones anymore to
Yes.
any appreciable degree. And
Hmm.
so, what someone like me would require, which is not attractive on any level, would be surgical intervention in which the upper jaw is split right down the middle. An expander is then installed again under anesthesia into the jaw bones and splitting the upper jaw, the maxilla, including the sinuses, apart, and hopefully gaining whatever maximum amount of space we can get. That creates some horizontal movement, more room for even for me to allow my tongue to be resting on the roof of the mouth like it should. And then it might also require some mandibular advancement surgery in order to get more room so my tongue is not crowded up. So with an undersized lower jawbone like I have, my tongue piles up back there. There's no room for it to kind of stretch out and chill.
Yeah.
So I will eventually require that surgery. I'll require myofunctional therapy to rehabilitate my tongue, visiting Dr. Siegel to have the lingual frenum removed, and then probably a couple of surgeries to get me right. Fortunately for
And
me, I
you're
know
gonna need
people.
a mud pack therapy from us too.
Yeah, well, there you go. So,
That's a lot.
but fortunately for me, Danielle, as you're alluding to, I have resources available to me, people who can help
Yeah.
me in my journey. I know what I need to do. I have the surgeon that knows how to do it. I have the myofunctional therapist. I have you to help with all that aspect. So it's not so easy to get the tongue release and you're good, which is what I was alluding to earlier. It's more complicated than that, especially in the adults.
That's why it's so important. Like you said, we've got to start catching it when they're kids.
Ideally, that's why we're screening every child.
Yeah.
Again, I wished in dental school they talked to us about this. It still blows my mind as to why this isn't part of our curriculum when
Hmm.
we know the impact this has on health, not only as a child but as adults.
Yeah.
And
Well,
you start wondering, well, was this a concerted effort to keep this away? And I'm not the hugest conspiracy theorist out there, right? But you know, why isn't it being discussed? Why didn't we learn that in school? Why aren't we taught, well, when you're children, let's screen them for this. That'll cut down on cavities, and we don't have to rely so heavily on the fluoride solution for fighting cavities.
right. Well, I think as clinicians, we're always at least 10 years ahead of what is being taught because we're actually on the line seeing all these
Yeah.
clinical cases and seeing the
Yeah.
things that are
The time will turn. The tide will turn. Again, the information is so much out there that patients are asking now, and that's
yes,
going to start ideally, getting the local dentist to start questioning. Well, maybe there is something to it, and that
yes,
will ultimately drive the change. But for it to be taught in dental schools, for them to teach functional approaches to dentistry,
yes,
I still think is a long way off. But we can hope. Until then, it becomes imperative that the patient and that parent become their own best advocates. And then, like I said, search around, ask the right questions. If you're not satisfied with the answers you're getting, go somewhere else until
yeah.
you hit home.
One of the other big topics that I'd love for us to briefly touch on here that I think is a really big one when it comes to dental health and also its impact on the rest of our physical health
Yeah.
is root canals.
Oh yeah. Okay. Well, let me say this: root canal. The whole root canal controversy has been just that for quite a while now.
Yes.
Um, in essence, the controversy stems from this: is it's really the procedure itself, the nature of
Mhm.
the procedure. So
Right.
in a perfect world, as we're performing root canal therapy, we're removing the diseased tissue from inside the tooth, and that usually means the nerve and the blood supply,
Right.
which will die off after some sort of insult. Let's say a deep cavity, which brought bacteria in there, or physical trauma, most commonly. Okay, if the nerve has physically died off, and that might result in some pain or swelling or some other symptom that's easily diagnosed, then the dentist is going to tell that patient, oh, by the way, the nerve died off, but if there's a decent amount of tooth structure remaining, I'm going to tell the patient, hey, we could save your tooth. What do you think about that? Oh, yes, please. The patient will say, please save my tooth. Okay, well, to do that, we're going to perform root canal therapy, in which we're going to remove the nerve and blood supply from the tooth. We're going to do our best to sterilize it, and then we're going to put a special kind of filling into those roots, and then probably put a cap on the top of it to make the tooth strong again. Does that sound okay, Mrs. Jones? And usually Mrs. Jones will say, okay, sure, whatever you got to do to get me out of pain. End of conversation. All right. There's really no discussion about what are the alternatives, which in most cases are told the only other alternative you got is you're removing the tooth.
Hmm.
And usually when that decision is being made under duress, like usually while you're sitting in the dental chair or the patient is suffering in pain, most people are going to say, no, no, take my tooth out. Please save my tooth. And both
Right.
the dentist and the patient are happy about that, as they should be. Hey, if you can save a tissue and let me hold on to my tooth, life is certainly less complicated.
Hmm.
That does not take into account what happens after that tooth is treated and what effect is that procedure, which results in now the body holding on to or being forced to hold
Hmm.
on to a dead tissue. What impact does that have on the body?
Right.
Well, the let's say the shortcoming or uh, the inability to completely sterilize the inside of the tooth is really the root cause. Pardon the pun there, but is really the issue. If one would look at even one of these little front teeth down here, which are pretty straightforward, straight root, single canal, not very large, the internal anatomy of those teeth, we're talking on a microscopic level,
Of
is
course.
so very complex.
Sure.
And so the only thing that a dentist can do, or an endodontist, which is a root canal specialist, the only area of the tooth they can clean out is the main canal that runs right down the center of the root, which we can see on an X-ray and we
Hmm.
can visually see, clinically, in which the area is cleaned out, filed with some special materials,
Yes.
which then allows the dentist to remove the debris that is created, flush the tooth out most commonly with sodium hypochlorite, which we know is Clorox or bleach, and
Right.
then dry it out and put a filling into the root, pardon the expression, but much like putting a cork in a bottle. At that
Hmm.
point, the symptoms are usually gone or much improved, and the dentist pronounces the tooth ready to go. They'll then, restore the tooth with a crown or maybe a filling, and that's it. Patient's off to the races.
We
But
pray.
that's only the beginning. All right. And really,
Right.
the problem is as I alluded to, the inability to completely sterilize that tooth 100%. Okay. So, because of the complexity of the inside of the root, and again, now imagine if a single rooted tooth is a problem, what about multi rooted teeth like molars in the back, which have lots of parts and pieces?
And they're
Well,
more common for root canals, right?
yes, most commonly, especially in the bottom molars, which are
Mhm.
usually the first teeth to come in the mouth and usually the first ones to get fillings. They're the most prone, short of having trauma or facial trauma, they're the most prone to developing root canals.
Yes.
Um, and so, generally, most people are going to say, no, like I said before, save my tooth. And that's the end of the discussion. And if the pain goes away, then the dentist pats himself on the back, going, "We did a good job, patient's happy," and moving on. But slowly but surely, those teeth, by virtue of not being able to be sterilized 100%, will start to become reinfected. And although they don't necessarily create symptoms right away, um, the process by which infection is forming goes on unabated. And
Yeah.
depending
Yeah.
on how well the tooth was treated initially, that's going to determine just possibly how much of a honeymoon period are you going to get before
Hmm.
this starts to raise its ugly head again or become problematic. Now, even on conventional X-rays, once a root canal has been done, a dentist might see something that looks similar to what we would usually diagnose as an infection around the tip of the root. But if there are no symptoms and the patient doesn't complain, they might, kind of chalk that up to something like scar tissue or make some other excuse as to why it doesn't look like a textbook photo of a root canal tooth. But yet, if
Sure.
there are no symptoms, then it's okay.
Right.
Okay, so unless there's swelling or pain and the patient is complaining this tooth's never right, they're not going to give it a second thought. And the rub there is that now allows a patient to hold on to or retain a truly infected tooth for extended periods of time, like years or decades.
Oh yeah. And now they end up with autoimmune disease
All
and
right.
they're
So
wondering why they're
there
exhausted. And
you go. As a result of this chronic low grade or subclinical infection that hardly anybody's talking about.
yes.
So the best treatment is no treatment. Okay. Unfortunately, if there's a situation where the tooth is going to have root canal therapy or definitely requires it, then
Hmm.
unfortunately the only alternative is to remove the tooth. But
Right.
that is comes with its own consequences. So
Sure.
it's difficult for a patient, again, sitting in a chair under duress, to consider all those things and then decide, man, do I want to do this? No, no, just save my tooth, and I'll deal with it later on.
Hmm.
The dental insurance will cover it. It's all good. You had a crown. Everything's good. Everybody's happy, the dentist and the patient. And so it's easy to sort of make that decision to say yes to the root canal because the dentists themselves don't really know to what degree the controversy rages. So in dental school, you're not taught to worry about them. We're just thinking if they're done well enough, then the patient's pain and symptoms go away, and that's all we need to know. And if
Mm.
it lasts a bunch of years, that was a success. But if you ask any oral surgeon, what is the most common type of tooth you extract? And they'll all say root canal teeth that failed because they do have that potential propensity or potential to
Right.
fail at a later date where the symptoms are at a point where the patient can't tolerate them.
Right. Right. And they're filling it with some pretty toxic materials
And
too.
that too. So if you have a tooth that's not fully sterilized and then you put some materials in there that are less than biocompatible, then yeah, you
Right.
have a recipe for problems. And as we know, the problem starts inside the tooth, Danielle,
Right.
but it doesn't mean that it stays there.
No.
The teeth are somewhat porous. And
Mhm.
what is also not being addressed is that virtually every tooth that has a root in it will have the main canal, which right down the center of the root, and have branches off that canal that
Sure.
cannot be physically cleaned out. So
Sure.
invariably, there is some organic material that's left behind inside of the tooth that cannot be physically removed.
Right.
And if anybody knows anything about liquids,
Mhm.
a chemical property of liquids called surface tension makes it difficult for liquids to completely disperse inside very tight spaces. And
Right.
therefore, when a dentist is kind of washing out the inside of the tooth during root canal therapy, it's difficult to remove all the debris.
Yeah.
The tooth, unfortunately, doesn't kind of absorb that chemical, whether it's EDTA or bleach, it
Hmm.
doesn't absorb that liquid like a sponge would into the entire root and saturate that entire root. If that were the case, then we might probably get a higher degree of sterilization. But the
Right.
reality is it doesn't. So the only part of the tooth that gets sterile is down the main canal. The rest of the roots are not sterile. And because of that, organisms that find a way to survive in that environment then are pretty bad stuff. Uh,
Absolutely.
any any anaerobic microorganism, whether that's bacteria, can either undergo something called pleomorphic changes over time, which actually changes their inherent nature from bacteria to virus and even a fungus.
Hmm.
Again, that stuff doesn't stay in the tooth because the roots are porous. The byproducts then will leach out into the surrounding jawbone, first into what we call the periodontal ligament space, which is this tiny ligament-filled space between the root of the tooth and the surrounding jawbone. And as
Right.
the patient bites down, that ligament then compresses as the tooth acts kind of like a pump to force the exudate coming out of the tooth into the surrounding jawbone. And then from there, your lymphatic system and or your circulatory system will allow that toxic juice to flow from that area and potentially set up shop somewhere else. Perhaps
Absolutely.
even perhaps even a place that a person is genetically predisposed to developing disease, or had
Mhm.
a history of surgery in, or an old tooth spot that was missing that wasn't treated properly. I mean,
Yes.
any number of possibilities are associated with that, and there you have the problem that although it solves one problem, meaning allowing the tooth to stay in place, it also tends to lead to other problems down the road. And because the symptoms of, let's say, like you mentioned, an autoimmune disease, or an arthritis, or God
Hmm.
forbid, a cancer,
Hmm.
doesn't show up right away, it's hard for people to connect the dots and say, well, you had a
Right.
root canal 10 years ago.
Exactly.
That's the reason why you're having this now.
Then they look at you like you're crazy.
Oh, well, yeah. I mean, hardly anybody's looking at. And the other issue is that, as we alluded to earlier, that we are electrical beings, although we're flesh and bone. We're
Yes.
essentially, the body electric. Here is also subject to the changes in energy, placed on it or removed from it.
Yes.
And the other issue here is that root canals represent the only instance in all of medicine that we allow, and ideally actually are forcing, the body to hold on to dead tissue.
Yeah.
In no other experience or instance will we allow dead tissue to remain in the body. And if
Right.
that dead tissue is also infected, there you go. You got a recipe for disaster.
Yeah.
So if we have a tooth that's kept in the mouth, the other consideration in our office or most biological dental offices is say, hey, what about the tooth in particular that's being affected? What acupuncture meridian does that tooth fall on? And
Right.
is that dead tissue now interfering with the flow of chi or life energy through that meridian? And therefore that meridian has now been compromised. You can't go to an acupuncturist and have them put a needle in there and twist it around. It's not going to restore the chi.
Right.
So by removing a tooth like that, and we could probably spend another podcast about talking about surgical removal and what people need to be on the lookout for with that.
Yes.
Uh, Conventional means of removing root canal teeth also tend to fall short. And so, unfortunately, sometimes all of the problem, let's call it infection, is not removed at the time an average root canal tooth is being removed by an average oral surgeon, let's say.
Yes.
So if it is done properly, then the health is restored to that area, even though a person might be minus one tooth in that vicinity. If the tooth is removed properly, if that diseased periodontal ligament is removed, and the diseased bone, which sometimes becomes sclerotic or devoid, or what we call ischemic, devoid of blood flow, if
Yes.
that area is removed and the area is repaired with the body's own bone and maybe blood concentrates like PRF, then we
Yeah.
can restore that meridian and restore the bone to its full health and allow the chi to fall through there the way it ought to, even though the tooth might be gone. Then you can really or realistically remove the threat that root canals pose to the rest of the body.
Yeah, it's like a ticking time bomb. We had spoke with Janine D'Angelo, who is a thermographer,
Yeah,
New York, New Jersey, Connecticut, Florida, North Carolina. She's got sites throughout, and she said one of the big things that they see in their scans is literally because it measures the heat and the lymphatic and where it's drainage, and
yeah,
a lot of women tend to move towards thermography. Not that it's not for men, but
yeah.
what she sees so commonly is literally the red line going right from the teeth and the jaw
Drainage.
all the way
Yep,
down to the breasts.
yep, yep.
And it's like, well, this is a problem that
It's a problem.
we're
It's a
not addressing.
problem. And by the way, which can compound it. So it's bad enough if you have any root canal tooth in the mouth, with
Right.
gravity is going to help drain stuff right down there.
Yeah.
But if that tooth also happens to be on a breast meridian, let's
Yes.
say upper molars or lower premolars, then
Hmm.
that might make it even easier than for a woman to express a breast cancer. And if
Yeah.
they have the BRCA1 gene or the other, again, other genetic predispositions, then you have the recipe for disaster.
Right. And we're
Yeah.
not thinking about these things. We're thinking, oh, it's just a root canal. It's common. It's every day.
Exactly my point. And therefore, that's why it's hard to get upset with the dentists who are doing it, because they don't know. They're taught that this is the right thing, and most of them are very altruistic. I'm helping you. I'm
Yes.
saving your tooth. Isn't this great? And they
Yeah.
believe they're doing good work. And
Right.
kudos to them. It's just, again, it's the nature of the procedure, not the doctor, that we have to be upset with.
Yeah. Well, I always say we do the best we can with the knowledge and resources
Yes.
that we have, but
Yes.
we've got to keep
Agreed.
questioning what the status quo is to make
Yeah.
sure the status quo hasn't just become the status quo, and
Yeah.
that there aren't new things that we know and understand. It's no different
Agreed.
than in our nutrition.
Yeah.
Like Nutella says best breakfast food. Well, really? Was it
Yeah,
really
right.
best breakfast food? So we've got to start to question what we've kind of taken for granted, and
Agreed.
that's when we start to see, oh my gosh, like there's a whole different world out
There's a
here.
whole other world out
Walking
there.
around with sunglasses on,
Yeah,
not even realizing that everything's been filtered in a certain way.
agreed.
Well, I think, of course, and this is a question I always, ask our guests. I think, these are all things we have to contend with, right? None of us are perfect. We have all these imperfections, and we probably all have cavities, or many people have root canals, and prevention is probably the most important
Agreed.
piece.
It's a big topic
So
in our office. Yeah.
yeah, and maybe we're past that point, but there's still things that we can do to even maybe turn the ship around the right direction. So
Agreed.
I always ask, what are three things that you would recommend for our listeners that they can immediately begin to implement to start to really take care of their dental health and become really conscientious of it?
Okay. Well, great question, and I'm glad to answer it. First thing, I would again have the mouth evaluated by a myofunctional therapist. If an adult person is finding themselves prone to developing cavities, again, one thing that often gets overlooked is the airway situation.
Yes.
So addressing that, which we discussed about myofunctional evaluation and maybe Dr. Martin's device that might allow them to breathe better when they're sleeping, those kind of things. Good
His
start.
pillow, by the way, is great. I don't know if you have his pillow.
No, not yet. Not yet.
Oh my God, his
I
pillow
was
is
going to look into that. But let's assuming that all things considered equal, if someone, and I would tell this to an average parent too, who's concerned about why is their child who is not receiving sugar in their diet developing cavities, and I would say
great.
probably the number one reason, let's say the one thing we could pick on that we can implement immediately would be two things. One would be a good mineral source. All
Mm,
right. Danielle, you probably know a lot of your patients, most adults are chronically mineral deficient.
neural efficient. Mm,
Our foods are not so nutritious anymore. And unfortunately, the way agriculture is in this country, our soils are not so healthy and they're stripped bare. And with the help of chemicals, we can continue to grow crops in the same spot for years on end. But the fact is, most people are not being counseled, again, from their pediatrician on to
right.
their OBGYN about how much minerals are you getting in your diet and how do I get them? Well, there's any number of mineral sources. Let's assume someone who does not have the MTHFR mutation, which makes things even more challenging. Then it becomes kind of simple for someone to say, well, I'm just going to add some more minerals into my diet, making sure that I get a good quality vitamin D3 with K2 supplement to
Yes.
ensure that those minerals get to where we want.
Mm-hmm.
And right then and there, now you're kind of giving the body the fuel it needs to help maintain the hard tissues
Mm-hmm.
like your bones and your teeth, the vitamin D3 with the K2, and it will virtually guarantee that those minerals get to where we want them. So even though we're taking that by mouth, okay, like we give fluoride to children, taking it by mouth and hoping that it gets to where we need to, well, yeah, the minerals do go all over the place, and we
Mm-hmm.
want them. Some will make their way to the teeth. Some will make their way to the bones. Some will make their way to other parts of the body and help the body to maintain its nice environment, which would then also help balance the body's pH. All right,
Exactly.
so getting pH balanced, which also is a role player in the onset of cavities. Typically, a
Yes.
low pH environment is going to make it easier for the bacteria involved in that process to do their dirty work. But if we're trying to balance pH, get the food, the bones and the teeth, the building blocks they need, then an easy first step: vitamin D3 with K2 and a good mineral source. And those mineral sources could be something as simple as a good quality sea salt. Uh,
Sure.
Cheap and easy. You can get humic or fulvic minerals in a liquid form if you prefer, or get a capsule or tablet from someplace, as long as it's good form. Again, I think the confusion for most consumers out there is to know which one. Minerals come in various different forms, and whether that form is something that's going to be well absorbed or bioavailable, then that really is dependent on what the manufacturer is doing. But assuming that we get a good mineral source, that's absolutely key. A good sort of, if someone was going to use sea salt, for example, then a good recipe would be, let's say, about anywhere between a half and three-quarters of a teaspoon in about a liter of water. And someone can
Yes.
make a home version of a mineral water, assuming you have some good filtered water, and add a sea salt in there,
Yes.
and swish and swallow that stuff all day long. Even for
Yeah.
children, you can sprinkle it on your food. And persons who like salty or foods that are zesty and flavorful, then use the sea salt liberally. We're not worried about high blood pressure like regular table salt might do with
Yeah.
excessive
No
amounts of
table
sodium.
stuff. No table
So
salt.
no table salt. Sea salt, by all means, use it liberally. Get your
Yes.
D3 and K2. That's a great first step.
Yes.
What else? If someone was wanting to know, what about toothpastes? Well,
Yes.
we
Great
pretty much took
question.
apart the use of fluoride, right? We kind of agree that maybe fluoride isn't the best solution.
Yes.
But someone want to do something that's also helping the cause. And
Right.
therefore, the topical application of something to the teeth can also be utilized. In this case, substituting hydroxyapatite
Yes.
for fluoride. So using a hydroxyapatite containing toothpaste, maybe something with some herbs in it that might help gums for adults.
Hmm.
Something that has some natural flavoring if you're looking at a kid. Maybe something with xylitol if you want to help something also create an environment that is not friendly to bacteria. Then we say look for a toothpaste that is fluoride free, that you can hopefully pronounce most of the ingredients in there, and that might include hydroxyapatite. Now, I want to make a distinction about that because if someone were to just go to their Amazon account and look up fluoride-free toothpaste,
Right.
there's going to be a whole host of them out there, and those that are advocating hydroxyapatite also makes things confusing.
Yes.
What we've been seeing is that a lot of companies, including I think Boca and Risewell and a few others that are generally good products, are advertising something called nano hydroxyapatite.
Okay.
Nano referring to the particle size of the hydroxyapatite molecule,
Yes.
which in theory is great. You'd want small particles which can easily be absorbed onto the surface of the enamel, brought into the tooth, and help reinforce that outer shell of the enamel, making repair on a daily basis. That helps make that enamel shell, resistant to acids and abrasion and stuff. But what we're finding out is that some forms of these nanohydroxyapatite particles are actually too small, and therefore can wind up getting absorbed by the blood vessels inside the mouth as you're spending time brushing, and get into the interstitial tissues. So spaces between cells, your mesenchyme, whatever you want to call it,
Right.
that might not be wanting to have these particles in there. So the idea is, well, if we have the particles too small, that's no good, even though we like hydroxyapatite and in and of itself is not toxic. But if it's getting to places that we don't want it to, then there's a problem.
Sure.
So I would say probably a good selection would be get a toothpaste that just says hydroxyapatite and not nano. So
Do you
there's
have
some,
fragrance?
there is a product called, I believe, Revitin, Revitin,
Okay.
created by another biological dentist, Jerry Curatola, right here in New York.
Okay.
He came up with that. I think it's a very good product. Does not have that, but it should say on there, on the label,
Mhm.
hydroxyapatite without the word nano right in front of it.
Okay.
So again, and I found this out as we're in the process of making our own tooth powder because of
Oh,
all the confusion about, yeah.
you're going to have to let us know when the tooth powder comes out.
I will. It's in phase 2. We're trying to get it to taste great. It's all got great ingredients, and we're trying to get it to taste right, so it's palatable.
Yes.
But that's when I discovered about the the controversy, about the nano thing, and I thought, okay, let's stop that. So in
Right.
the hydroxyapatite I'm using is a non-nano form,
Yes.
but it'll just say hydroxyapatite on the
Yes.
toothpaste. And I think the manufacturer's starting to get hip to the idea that, well, maybe that was because they all blasted out there nano because it's a marketing tool,
Sure.
which again sounds great on paper, but I would be a little cautious about that. But
Right.
there are definitely products out there that will say hydroxyapatite and maybe some herbs, and that's probably
Yes.
your best bet. And if you like the taste, then you're probably good. But
Awesome.
toward that end, I would say, the toothpaste itself is not the be all and end all of cavity prevention. Again,
Mm-hmm.
nutrition, diet, lifestyle. I mean, a lot of things that you're doing outside the mouth that you're doing for your body are also going to keep things in check.
Yeah.
And again, in that end or toward that end, your gut microbiome is absolutely critical. So, get your gut in good shape. Get your friendly bacteria amped up. Eliminate whatever you have to from the gut, including fungus and other stuff, in order to allow that tube. And here's the beginning of your gut, right here.
That's your
And
mouth.
that whole gut, that whole tube is happy and healthy. Then your teeth are going to be happy and healthy, and so will your bones and all the other things we want.
Yeah, absolutely. I love that you talked about minerals because that's a really big deal. So
Yeah,
once we've got clients in a better health state, I always have them start to monitor their first morning urine pH.
yeah,
And not only that, but if their diet's really good, their nutrient status is really good, if they can't get their first morning urine pH, it's always an indicator to me that there is likely a dental infection that's hidden that
mm,
they can't even find.
yeah.
And then I tell people too, it's funny, it's like your teeth and your bones are pretty solid and stable.
Uh,
And so if you're not making sure that there's not hidden infection in your body, you're not getting those minerals in. Well, where's your body going to go to keep your pH in balance? You're going to start losing it
yeah.
from your teeth and your bones. Osteoporosis doesn't just show up, right? We don't just
I
start
make that.
losing teeth.
Yeah, that's exactly right. I make that comparison all the time to a lot of ladies who are, let's say, perimenopausal.
Yes.
They'll come in and they get the diagnosis of, by the way, you're osteopenic or you have full blown
Right.
osteoporosis.
Right.
And then now, oh, I'm scheduled to get the injection, the
Oh yeah.
bisphosphonate or something like that. I'm like, whoa, 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 pump the brakes.
Yes.
Just understand that your expression of osteopenia, osteoporosis is really a chronic expression of some other imbalance.
Yes.
And in all
Exactly.
likelihood, it's been decades since you've had adequate amounts of proper minerals. Again, due to the way agriculture is in this country, that most people aren't getting counseled by the physician, and the foods, no matter how picky they are about them, organically farmed or not, are just not as nutritious as they once were. So
Right.
no matter what we're doing, we're going extended periods of time without those basic minerals, which is so key.
Yeah.
But you touched on something, Danielle, which I'm glad you did, as you were alluding to or mentioning about the urine pH in the morning, that there
Yes.
may very well be a hidden dental infection.
Yes.
Well, one of the other tips I would tell someone is absolutely critical. In order to discover something like that,
Mhm.
what is required now is a better form of imaging of the teeth and the jaws to uncover those often hidden infections, which many times have zero symptoms, which is why they
Right.
tend to go uncovered.
Right.
So what's becoming now the new standard of care for complete oral evaluation to uncover hidden infections is something called a CBCT, which stands for cone beam computerized tomography, also known as a 3D scan, is now being offered in most dental offices. We have one in our office because um, it's something that's an absolute necessity to uncover infections that can be hidden in any number of places,
Right.
especially in areas where teeth had previously been extracted, like what do
Yes.
most people have extracted? Four wisdom teeth, or if
Right.
they had let's say, an inadequate airspace and they had lots of crowding as a kid, and they went to the orthodontist and they said, "Oh, in order to straighten your teeth out, we're gonna have to take out four perfectly good teeth in order to unscramble the crowding that's going on in there." And not
Right.
only do we make the mouth smaller, we oftentimes create an area where the bone didn't heal in those areas and the infection may return. Those
Yes.
root canals we talked about previously or earlier, another one. On average x-ray, sometimes they look perfectly normal. I
Mm-hmm.
use that term loosely. But sometimes when you look at that tooth, on a 3D scan or a CBCT scan, you're going to see a completely different outcome and see things that were hidden or not so noticeable due to the extreme, what I'm looking for, resolution or much higher resolution and high def image that we get from those 3D scans. So,
Yes.
absolutely incredible information that can be gleaned from that, but critical for the patient to get that. Now, not every dental office has that because, again, this is not in the realm of the average dentist. We're taking four
Sure.
bite wings and two PAs type x-rays and maybe a panoramic image once in a while, but that doesn't necessarily give us all the information we need. And if a
Sure.
dentist is not looking through a different prism, like biological dentists, we look through slightly different prism,
Sure.
looking at images where other dentists will take things for granted. We don't. But one of the ways that we can sort of prove to patients that we see something that is less than ideal is with the CBCT, the 3D scan.
Right. Right. Awesome.
Yeah.
Well, I know we chat for hours upon hours.
Yeah, I got time.
But I am so grateful to have you
Thank you
on.
so
We'll
much.
have you on again. I'm
I'm
sure
sure.
there's so much more that we can cover.
Yeah.
And I do want to learn. So you can learn more about Dr. Fazio and his practice at holisticsmiles.com. In case you missed it, his practice is located in Smithtown, New York, which is on Long Island. And like I said, I've known Dr. Fazio Fazio for almost 20 years now, as he's been my own dentist forever. And I'm so grateful to have found him, and someone who is thinking along the lines of, hey, how do we look outside the box, and how are these things impacting us and our health? So please be sure to take a look and connect. And I certainly look forward to having you on at some other time in the future.
Absolutely. I'll be here. I'll be waiting.
All right. Thank you, Dr. Fazio.
Namaste, Danielle. Thank you so much.
This is Dr. D reminding you to tune into your body, connect with what matters, and embrace the journey to true wellness. If you enjoyed today's episode, be sure to subscribe, leave a review, and share it with someone who's ready to redefine their health. Be sure to grab a copy of the True Wellness Checklist right in the show notes. Let's keep redefining wellness and empowering change together. See you for the next episode.